So we are talking about the perinatal home visiting program. We know we started with a pilot. Tell me about the status of the pilot program and how that is going so far.
Sure, it's going really well. We started with funding from the Georgia legislature in July of 2023 with 21 counties. We started ramping up that program. It really started doing services in October of 23, and then we received additional funding from the legislature in July of 24, so we're up to 50 counties. And it's really been a short period of time that services have been delivered, and we've seen some really great outcomes. We're really seeing improvements in care to mothers and infants. We've hired some incredible staff, some really passionate, dedicated home visitors who love their work, who love the participants that they're seeing. We're just really proud of the progress so far.
So tell me, who are the home visitors? Who's going out?
Sure, it's a mix of registered nurses and community health workers. So they work together to see the participants in their home.
Why did we think this program, go ahead. Why did we think this program was needed in Georgia in the first place?
Sure, the need for this came out of recommendations from the Maternal Mortality Review Committee. They recommended home visiting as a way to lower maternal mortality in the state, to make sure that mothers were aware of maternal pregnancy warning signs, things to be on the lookout for. And we knew that having home visitors in the home would be a way to kind of monitor some of those conditions and make sure that moms were referred to care when they needed to be.
What are we seeing right now in the pilot as far as some of the health issues that women are facing once they're released from the hospital?
So the program does see women from pregnancy all the way through a year postpartum, and they're referred for multiple reasons. They could have had a previous high-risk pregnancy, and so they need a closer look during their pregnancy in between their prenatal visits. We see women who have chronic health conditions like diabetes, so that it's good for them to be visited between their normal prenatal visits. We also see women who have mental health conditions or substance use disorders and need those connections to resources that they may not get unless they have someone coming to talk with them, identifying their issues and connecting them to the resources that they need.
That's a wide range. So who's actually eligible to receive this in-home care?
Anyone who meets the criteria that I just said. It is pretty wide because the issues facing our pregnant moms vary. So if an OB identifies a mother who is at risk of an adverse pregnancy outcome, they'll refer them to the program. And it could be for social reasons, like maybe it's an adolescent mother with a poor support system. That mom could be referred to the program. We also get referrals from our WIC program, from community-based organizations, and a mom can self-refer. They can go to our health department website and contact them and say that they're interested in the program because they feel like they need that extra support during their pregnancy.
And after?
Yeah, and a year after.
And so is there an income requirement, insurance component?
There's not. No, there's no insurance requirement. Mothers are seen regardless of that status.
So do we have like a cap on the amount of women we can serve, or is there a cap just from the financial component?
There's this I'll have to think about how to say.
Okay, that's okay. I'm just basically trying to ask, like, say for example, would there get to a point where you say like, oh, we can't service? Because like, say for example, after a news story, it may get more buzz, and you may say like, is there a scenario where you say, oh, capped out?
Yeah. I think we'd only be limited by the caseload that a home visitor could carry. So right now we have capacity to continue increasing and seeing more women and infants in the areas that we're serving currently. I think that if we get to a point where our caseloads are too high, then we just would need to look to hiring more staff to be able to serve that population.
Got it. And let's talk about the ability to do that. This new funding from Governor Kemp. Tell me about that and how we plan on seeing that manifested.
We're really excited that we saw additional funding in Governor Kemp's budget for FY26. It'll allow us to serve an additional 25 counties, so we'll be able to go to 75 counties where our program is located, and we're just really excited about that support.
All right, and so what are the main things that you guys want to build upon now that we're in year 2 of this program?
We are working on our relationships with OBs at the local level, just getting the word out about the program so that they can identify high-risk patients that they can refer to the program. We want the OBs to understand that this isn't taking the place of prenatal visits, but it's a way to support their patients in between the prenatal visits and their postpartum follow-up visits. We're there to assess the mom for maternal warning signs and then refer back to the OB if anything is found, or to the pediatric provider. So we're working on those relationships with the providers so that they know that we are there to support their patients and to refer to the program.
Because if you think about it, the mom really only does the 6-week appointment, right? And then I'm just trying to think of my process, and maybe you remember the same. You really don't go back to the doctor for 6 weeks. The baby goes in the first week.
Right. And postpartum, it becomes a lot about the baby, and mom stops thinking so much about herself and things to be looking out for. Maybe thinking, oh, this headache is because I'm tired. Of course, I have a new baby, but we want mom to think about herself, to know what to look out for in those postpartum warning signs, changes in vision, dizziness, headaches, extreme swelling. Those are our warning signs that they learn about from their home visitor to know to look out for, that it's not just about baby, because if we were to have our healthy baby, the mom needs to be healthy as well.
And so many people, even your family members in your support system, there are so many people that are going to immediately come and check on the baby.
Right.
Yeah. And so even mom, that's your number one focus, is to care for the child. And so I think that's a component of like, hey, you matter. And it kind of sets the stage for the entire thing.
Yes.
Don't forget about yourself in the process.
It's true. And the home visitor, through that pregnancy and postpartum, builds a relationship with their participant, with that mom. It's the same home visitor that's going out there, so it's not rotating. They build that relationship, that rapport, the trust. And when that visit happens postpartum, it is about the mom. How is mom doing? There's mental health screenings. Do we need to refer to support for any mental health issues that may be coming up? And you're right, it really shows like we're focusing on mom. We need mom to be her best so that baby can be their best. We assess the baby too, make sure that they're growing properly, that feeding is going well, do developmental screenings, but we really want mom to make sure that she has everything that she needs to keep that baby there.
So what did we learn from the pilot program?
Yeah, so when we looked at the data of moms who delivered, about 75% of them delivered at full term, which is what we want to see for that healthy delivery, and about 75% of the infants were at a normal birth weight. So we are excited the data that we are seeing. We're continuing to monitor those data, and as we expand to additional counties, we will continue to be reviewing the data. We do annual reports of what we're seeing so that we can keep growing the program, see areas for improvement, and continue supporting mothers and infants.
Did we see anything that was really concerning from the pilot program to say like, oh, this is an area where we really have to give more attention to?
That I need to think about. I think one thing we've noticed from the pilot is that there's lack of resources in many of our rural areas. So our home visitors will identify a need for the mom. It could be a transportation need, could be housing, could be mental health support, and it doesn't exist in that area. So there has to be a lot of work to how do we still support that mom when there's not a resource maybe right in their community. We can see that sometimes through services to support the mom, but we've definitely noticed that lack, especially in our rural areas.
And we know that, we're still in the midst of reviewing Georgia's maternal mortality, our latest numbers and our latest data. But just as a mom yourself, seeing those numbers, what does it mean to you to be a part of a program that wants to drastically get those numbers down?
It's so special to be a part of this kind of work. I mean, our home visitors are the most dedicated people you will meet. They do really hard work going, traveling around their counties, and these rural areas are really far apart, building these relationships with moms. We have some stories of really great saves that we've had, and that the mother's life or the infant's life being saved is attributed to this program. It doesn't get better than that, than knowing that work that we're doing is actually impacting lives.
And so as we move on, sort of, out of a pilot phase where we see you guys have received funding twice now, what do we see for the future of this program?
We hope to continue to receive funding. If we get this funding for FY26, we'll be in 75 counties, but there's 159 counties in Georgia, and every county could use this program. There are mothers in every county who could benefit from these home visits, and so we hope to be able to be at a point where anybody who needs this program can access this program.
So what does a home visit look like? What services are offered?
Sure. Pregnant women receive weight checks and blood pressure checks. They'll get glucose checks if that's indicated. They'll have a mental health screen, fetal heart monitoring, and connection to any resources that may be identified. If they need to be connected to WIC or SNAP or Medicaid, a transportation service, anything like that, that's kind of ongoing care and navigation that they receive. And then postpartum, the mom will also receive mental health screening, assessment for postpartum maternal warning signs, and they'll check the baby to make sure baby is growing well, that baby is eating, feeding is going well, and any developmental monitoring that's happening for the baby, and referrals to early intervention if that's necessary. Okay.
What are some of the stories that are coming out of this program?
We have a story of a woman who, because of the education she received from her home visitor about maternal pregnancy warning signs, she knew when she was experiencing a headache and vision changes and extreme swelling that something wasn't right. And she called EMS, and she was transported from her rural home to a hospital where she was diagnosed with preeclampsia and treated. And we know that because of that education and her quick action and the education she received from her home visitor, that she had a good outcome for herself and for her infant.
Yeah, because like you said, you just write a lot of this stuff off. You know, you don't know how you're going to feel. And even if you're a mom of multiple children, each pregnancy and postpartum period can be different. So you don't know what's happening. You think everything is just whacked out because you just had a baby.
Right, yeah. And when is something just a headache, and when is it a sign of something more than that? And so a lot of what the home visitors do, I mean, they're doing these clinical checks of weight checks and blood pressure checks, but they're also educating the mom. So they're educating them on these warning signs. So this is what to look out for and what to do if you notice these things. And we've seen that play out in a way that saved lives.
Yeah, it's so sad too, just the lack of information. The young lady who I spoke to, she said that she never, in the hospital phase, never received any knowledge like, hey, when you get home you should check your blood pressure once or twice a day. I remember getting that information like, hey, we want you to get a blood pressure cuff, we want you to check it, and these are the numbers, the target numbers that you should be within, but not everyone is getting that sort of discharge information.
Yeah, and even if they are, you're in such a fog, you just had a baby. These things aren't going to stick, and you could get a brochure that comes home with you, but that goes in a pile with all the other things. But then you come have your follow-up visit with your home visitor, come into your home and talk to you about these things, that's going to stick. Or even if it doesn't, she's going to take your blood pressure there as a way to monitor it. So it's just that way to enforce that education.